Hello everyone, I'm President and CEO Mark Tarr, and this is Quarterly Connection. It's hard to believe, but 2025 has already come and gone. The fourth quarter provided a strong finish to a busy and successful year. We saw discharge growth in the fourth quarter of 5.3%, contributing to a year-over-year discharge growth of 6%. During the fourth quarter, we opened our last 3 new hospitals of the year in St. Petersburg, Florida, Amarillo, Texas, and Lake Worth, Florida, bringing our total for the year to 8 new hospitals. Between those new hospitals and expansions to existing hospitals, we added a total of 537 beds across our footprint in 2025. The ability to have multiple means from which to expand our bed capacity is a big part of our company's strategy. You'll be hearing more about a small format hospital plan in the near future. Most importantly, we continue to provide outstanding care to our patients, with a high percentage returning to their homes after discharge. Our impressive quality and patient experience scores continue to outperform the industry average. In fact, in the fourth quarter, NRC Health recognized us among the top 3 large health systems nationwide for excellence in patient experience. Last year's success has set us up well for 2026. And we wasted no time. Already this year, we've launched an exciting new nursing program. I've asked Liz Squires, who leads our nursing operations, to share more about the new program and what's ahead for nursing this year. Well, hello, Liz, and thank you for being here with me today and talking about nursing operations. You know, I think it's obvious to those that are in the hospitals, but maybe not to everyone that's watching this today, but almost 37% of the total FTEs for the company are in nursing. So nursing is a huge deal for us. And it leads to a lot of complexities and things that you think about and deal with. And one of them is how to provide growth opportunities for our nurses and development within their career paths. And certainly having a clinical ladder is one way of doing that. I know you guys put a lot of work into developing this clinical ladder. You've had a lot of input from the field and other members of the leadership team. But tell us a little about the clinical ladder and what you hope to get out of it.
Yeah, thanks, Mark. We are committed to supporting our nurses' growth and development. So to do this, we created the Nursing Clinical Ladder Program. It is a 4-tier clinical ladder, and it has tracks for LPNs and LVNs, registered nurses, and certified rehabilitation registered nurses. Nurses are able to advance on the ladder based on tenure and also the accrual of points in 4 important categories: professional development, collaboration, leadership, and nursing practice advancement. The Nursing Leadership Board selected those categories because it really nicely represents a well-rounded professional nurse. Since implementation of the program, we've had some nice success. We've had over 1,000 nurses apply and advance on the program. And what's really nice to see is that when we look at turnover for nurses who are on the ladder, it is much lower than nurses who are not. So it's a great opportunity not only to reward and recognize our nurses, but it's also a great opportunity to retain them within the organization.
That's great. And I know it's a competitive advantage too, because we're competing with other hospitals and other entities out in the marketplaces that nurses do have choices. So they want to be with an organization that helps to invest in them and their careers, right?
Absolutely.
You know, another aspect with a subset of nurses is that they want to be leadership and they want to be in leadership roles. And I think historically, I think we have been guilty of putting people in these roles without really giving them and helping them to develop the tools to be nursing leaders. And
And that's another aspect that you guys have addressed around a leadership element of the clinical ladder. So can you talk about that just a little bit? And once again, what you see as the outcome for this clinical ladder?
Yeah, absolutely. So we knew when we started working on the staff level ladder that we wanted to include a track for nursing leadership. Like you said, our nursing leaders are so important to the success of our hospitals, and we know that engaged leaders provide environments where staff can thrive. And that in turn creates an environment where our patients are in a very positive, healthy environment where they can heal. So the Nursing Leadership Ladder, it is a 3-tier program. Nursing leaders can advance on the ladder through the accrual of points in those same 4 categories. Also through having continuing education in nursing leadership and based on tenure. We're very excited to launch this program, and we're excited to see what we can do to continue to grow and develop our nursing leaders.
Hey, I'm excited to about the launching of this clinical ladder and really both clinical ladders and because I think it's important for the organization. And you guys have made some really nice progress in reducing turnover and new RN hires in our hospitals and all of our startups. So I think it's a big part of that. What else should we be looking for just in terms of the future horizon for whether it's 2026 or in the years to come within nursing?
Sure. Another important initiative that we're excited about rolling out this year is Lippincott Solutions. Lippincott Solutions is a platform that provides bedside staff and nursing leaders with evidence-based resources. So now when we have a nurse who is performing a procedure that they haven't done in a while, rather than reaching for a manual or looking it up online, they can pull up Lippincott on the computer and trust that they have the most up-to-date, evidence-based nursing practice.
Very good.
Another exciting thing about Lippincott is that it has a lot of educational content that will be available to our staff. It has over 2,000 continuing education modules, as well as 500 interactive learning modules. So it's a great opportunity to make sure that our staff have the resources they need to be successful.
Very good. Well, Liz, thank you for everything you're doing. Clearly, these are important initiatives to the company and to our nursing teams and ultimately to the benefit of our patients. So thank you for everything you and your team are doing.
Thank you.
This year is off to a strong start. I want to thank each of you for bringing passion and purpose to the work you do. Every role matters, and together we make a difference every single day. Your dedication to our patients, their families, and to one another is what makes Encompass Health truly special. Here's to a year filled with growth, positive impact, and shared success.